My name is Dr. Lynn Scheepers. I'm the resident paediatrician in Aga Khan in Kisii. I see a variety of conditions. The most common ones would be abdominal pains. Most commonly, we see children with gastritis or hyperacidity that can relate to ulcers. So usually the older children present with those problems. And then another one is constipation or fecal impaction. So if there's lots of stools in the abdomen, it can also cause pain in the abdomen. Especially with children that had just started school, there's lots of viruses that are going around that their body is not used to being exposed to. So we see lots of runny nose, fevers, coughing, tonsillitis. Those are probably the most common conditions I see in my clinic. In my office, there is my desk and the chairs for the parents, and then we also have a little kiddies table and chairs with some blocks for the children to play with. So it keeps them occupied, so they also feel part of the consultation. A lot of the times I also get families of 3 or 4 children, and all the children are in my office at one time, and that also helps me to keep the rest occupied while I'm busy examining the other ones. My advice for parents for the optimal health of their child, from the time the baby is born, to start breastfeeding, and they continue exclusive breastfeeding up until the age of 6 months, and from then on you can introduce solid feeds. There are obviously some times where children shouldn't be breastfed or there's not enough milk, and then it's best to see a pediatrician so we can advise on the way forward. And then it's also important to visit the clinic regularly, especially within the first 5 years of life, so that we can monitor the weight, they can get their vaccines, and then we can pick up any problems, especially in development, and do further investigations if necessary. And then for the older children, it's important to have a balanced diet comprising of fruits and vegetables, and then also proteins, which is very important for their growth. It's important for children to be outside and to play, and then also not to have that much screen time. I see children from when they are born up until the age of 17 years. So if you are in Kisii and you've got kids around that age, and there's something that you got a question about, or they are sick, or they've got a chronic illness that you need a second opinion for, I am here and I'm happy to help you.